Let's bring in our good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us. Good morning, Dr. Joe.
Hey, Ray. Nice sunshine this morning. Good job, man.
Boy,
it looks good out there.
I will take it after yesterday. My wife and I went for a walk yesterday, and literally in the hour and a half we were out, we went through sleet, snow, rain, and sunshine all in an hour and a half.
I believe it. Yesterday was just terrible. Unbelievable. Really strange day, spring day. But the sun is out today, and the warming trend is coming forward. And one of the things about sports in our Northeast Ohio area, right now we have a little lull in the action. The Cavs are done. They had a great year. They were a lot of fun to watch. The Indians, man, they didn't want to play in the snow and cold like the walk you guys took, so they've been off the last couple of days. But one of the things that happened in the playoff game last Friday night, play-in game they call it, of course, in the NBA now, the play-in game, which was big for the Cavs, it was kind of a turning point play, actually, in the game, and the Cavs had that early lead. But there was a play when the big man for Atlanta, Clint Capella, pulled down Evan Mobley from behind. By the way, I didn't think that was a basketball play. I thought that should have been a flagrant foul. But then again, I've been a Cleveland Cavs fan for 50 years. But anyway, the oddity is he pulled them down, and if you remember, he pulled them into his own knees and had a pretty significant hyperextension injury. And I wanted to talk today, there's three mechanisms that can happen that can cause posterior cruciate ligament tears, PCL tears. And we don't talk much about the PCL. It's the poor little sister, the forgotten injury. While everybody talks about the ACL and other injuries going on in the knee, the PCL doesn't get nearly as much attention. But the classic mechanism in sport is if somebody really significantly hyperextends the knee, as the classic mechanism was the Clint Capella thing, or somebody falls directly on a bent knee on a hard surface like a basketball court or a turf, or for those of us athletes that are weekend warriors, maybe a motor vehicle accident, a car accident where the knees are bent and they hit the dashboard, and all of the force is placed posteriorly or backwards like it would be in a hyperextension injury, and the PCL is in the back of the knee. And so it isn't nearly as common as an ACL. In an office like ours, we might as a group see 4 or 5 or 6 of these in a year. We might see 5, 6 of the ACLs in a month in the Sports Medicine Center. So we don't see as many PCL injuries. So not as common. It often can go unrecognized because the first few days it just seems like a general sprain. It doesn't swell in the front of the knee, so it's not as easy to see. It's more in the back of the knee. And so a lot of athletes will just kind of ice it and walk it off and play, and, in a few weeks they may play with it. And many times it goes unrecognized. So, one of the things, though, is it just acts like a knee sprain. It usually takes about 3 to 6 weeks to get rid of the swelling and to get moving again. Rehabilitation speeds that up, obviously, PT. So for athletes, they get some PT with their trainer, athletic trainer, or their PT, and they're ready to go in 3 to 6 weeks. If it is an isolated PCL, this is a big thing here. If it is just a PCL with no other injury with it to the cartilage or the other ligaments, people can play with PCLs, and many athletes from high school through college through the pros play with torn PCLs. They may have a little shift of the knee, but nothing like the big shift with the ACL. So the PCL is one people do play with, and it's not one that we necessarily tell them they have to get any surgery done with it. It's not one that needs big, heavy bracing or anything like that. Many people play with PCLs. On the flip side, Ray, there can be a multi-ligament injury that can include the PCL, and those don't go unrecognized. And where somebody tears the ACL, the MCL, the PCL, it's called a wipeout injury or a terrible triad. They tear all 3 ligaments. And we talked before, this is a true emergency because they can injure the nerves in the knee, and they can injure the blood vessel, the artery in the knee. So we send them by SWAT if they have a terrible triad. And unfortunately, I've seen a few on the sidelines, and they're kind of scary. And some of them take a long time for the nerve to come back, if it ever comes back. So it's a bad, bad injury. And my question for you for the day, You're so good at these and you know them. What current Cleveland Brown player had a devastating, terrible triad wipeout injury when he was in college? Do you remember who it is?
Was it Myles Garrett?
No, not Myles Garrett, but this guy down at Georgia. And they still use his picture because he took over for Todd Gurley, who had been the running back the year before. And this was going to be his year. And in like the second game of the season, really gruesome. People in their talks still use the mechanism of how this happened to Nick Chubb. And Nick Chubb had a really significant injury. Many people around the country and doctors and others said there was a very good chance he'd never play again, maybe more than 50% that he'd never play. But you know the kind of guy Nick Chubb is. He went in the weight room, worked really hard, rehabilitated all those ligaments, got his strength back, and obviously, wow, what a wonderful, wonderful athlete and football player he is to watch. But he had almost a year and a half rehabilitating that wipeout injury that he had in his knee. And you sure wouldn't know it now when you see him run past, around, or through athletes, would you?
No, not at all. Yeah, he's recovered well, man.
Yeah. So the PCL is kind of one that it kind of takes a back seat, not talked about a lot. That hyperextension that you saw with Clint Capella just reminded me of that. I don't even know what his injury is. I did see last night that he's not back. But hopefully now we're turning the page and getting into a little bit of better weather for these spring sport athletes. It's so tough to be out there for track and baseball and lacrosse. Let's hope we have a good 6 weeks here for them to finish the season strong. And let's hope that we have a good week this week, Ray.
I agree, Joe. Good information as always, my friend, in the world of sports medicine. He's been with us for over 25 years. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Joe, thanks for the time again.
Thanks, Ray. Have a great week.
You too, my friend.